Health insurance is a topic many people avoid until they absolutely have to deal with it. But here's the truth. If you're relying on public health insurance, you might be setting yourself up for skyrocketing costs and diminishing benefits. In this video, I'm going to break down why I firmly believe private health insurance is a smarter, long-term choice compared to public health insurance. We will dive into rising costs, the advantages of private plans, and why timing your decision is so critical. Trust me, this is a conversation you can't afford to miss. Let's start with public health insurance. On the surface, it seems like it's a great system. It's easy to enroll, everyone's covered, and there is no discrimination based on pre-existing conditions. Sounds good, right? But the reality is far more complicated. Over the past decade, contributions to public health insurance have skyrocketed. Currently, you are paying up to 16% of your gross income into the system, and on top of that, many providers are adding supplementary contributions just to stay afloat. Why? The root of the problem lies in the system structure. Public health insurance is funded through a pay-as-you-go model, meaning today's workers fund today's retirees. As populations age, fewer people are contributing while healthcare costs continue to rise. This creates a massive financial imbalance that leads to, you guessed it, higher premiums for everyone. And this isn't just speculation. Experts predict that contributions will continue to climb in the coming years. For many, especially higher earners, this will become financially unsustainable. Now let's look at private health insurance. Unlike public health insurance, private plans don't base your premiums on your income. Instead, they're calculated individually, taking into account factors like your age, health status, and the coverage options you choose. This means that if you're young and healthy, your premiums can often be significantly lower than what you would pay for public health insurance. But here's the real kicker. Private insurance comes with built-in mechanism to keep your premiums stable over the long term. One of these is something called aging reserves, which are savings accumulated during your younger years to offset higher costs as you grow older. So while public health insurance premiums rise unpredictably with income and demographic pressures, private insurance provides a level of financial predictability that's rare in today's healthcare landscape. Cost aside, let's talk about the quality of care. Private health insurance doesn't just offer financial advantages, it also provides a higher standard of healthcare services. For example, private insurance often gives you faster access to specialists and diagnostic procedures. Imagine needing an MRI and being able to schedule it within days, not weeks or months. That's not a luxury, it's essential when your health is on the line. Additionally, with private insurance, you have the freedom to choose your doctor, hospital, and even receive treatments that aren't covered by public health insurance. Many private plans also offer extras like dental coverage, alternative therapies, and premium hospital stays, including private rooms and treatment by top specialists. Essentially, private insurance empowers you to access the care you deserve without limitations. If private insurance sounds appealing, there is one thing you need to know. Timing is everything. One of the major advantages of private health insurance is that it's easier to enroll when you're younger and healthier. However, the longer you wait, the more complicated it becomes. If you develop a chronic condition or need regular treatments, you could face higher premiums or even be denied coverage altogether. This is why making the switch early in life can lock in advantages that will benefit you for decades to come. It's also important to understand what you're giving up by sticking with public health insurance. As public health insurance becomes increasingly strained, it's not just the cost that's rising, it's the quality of coverage that's declining. We're already seeing reductions in benefits, longer wait times for appointments, and stricter limitation on what's covered. For example, some essential medications, dental procedures, or cutting-edge treatments may not be reimbursed at all under public health insurance. Instead, you will have to pay out of pocket on top of your already high premiums. This leaves many people frustrated, asking, what am I even paying for? Public health insurance is a system under pressure. And unfortunately, that pressure is being passed on to you, the insured. So what's the takeaway here? If you're currently in public health insurance, it's time to at least seriously consider your options. The private health insurance market offers a range of policies tailored to different needs and budgets. The key is to act before rising costs or health issues limit your choices. Speak with an independent financial advisor to assess your situation and calculate whether a switch to private insurance makes sense for you. Remember, this isn't just about saving money today. It's about securing a sustainable and high-quality healthcare plan for the future. In summary, public health insurance is facing significant challenges that will only get worse over time. Rising costs, declining benefits, and the lack of control make it a risky option in the long run. On the other hand, private health insurance offers financial stability, superior care, and the ability to tailor your coverage to your needs. If you're serious about protecting your health and your finances, don't wait. Explore your options today and take control of your healthcare future. If this video gave you valuable insights, make sure to hit the like button and subscribe for more tips in finance, insurance, and smart decision making. And let me know in the comments, are you considering switching to private health insurance, or do you have experience with either system? I would love to hear your story. Thanks for watching, and remember, your health is your greatest investment.